The interventions for postpartum hemorrhage are always going to be completed after the assessment has been done. The number one intervention for postpartum hemorrhage is going to be if the uterus is boggy, you need to massage it. You're going to apply firm fundal pressure and do circular massaging motions until you can feel the uterus firm up to about the hardness and size of a softball. The pharmacological interventions are going to start with asking the question, is there a retained placenta? If for some reason you think there's a retained placental fragment, you're going to call the provider because a surgical intervention is going to be necessary. If you don't think there's retained placenta, you're going to proceed to prescription interventions. Your first line of defense is going to be oxytocin. You're going to give it via IV bolus, and it causes strong uterine contractions that can help keep the uterus from bleeding. After oxytocin, you're going to move on to Methergin. Methergin, you give IM, and it's a powerful uterine stimulant that causes systemic vasoconstriction, which results in strong contractions. This is contraindicated in hypertensive patients. If you can't use Methergin, you're going to move on to Hemabate. It's an IM prostaglandin that increases uterine contractions. It cannot be used in asthmatics as it can cause bronchoconstriction. After Hemabate, you're going to move on to Misoprostol or Cytotec, which is a prostaglandin. You insert 1 to 4 tablets in the rectum, and it's contraindicated if there's a 4th-degree perineal laceration, as you do not want that to go into the vaginal mucosa. If bleeding is still uncontrolled at this point, you must return to the OR for a hysterectomy. Our non-pharmacological interventions are going to start with oxygen. You want to give your patient as much oxygen as possible, especially if she's bleeding. You want to monitor her blood loss. You can use a CBC to check her H&H, monitor her vitals for change, as well as examine her peripad for blood loss. If she has a perineal hematoma, you're going to provide ice to help with swelling and discomfort. As a result of the blood loss, postpartum women who have hemorrhages are at high risk for infection. It decreases their white blood cells, red blood cells, lymphocytes, monocytes, and all of the things that are in whole blood. So once she's stable, antibiotics are going to be essential. For all of your postpartum hemorrhage patients, you're going to want to make sure to replace their lost blood volume. You're going to give 1 to 2 units of blood depending on estimated blood loss. You want to make sure you have 2 IV accesses with at least 18 gauge and that you flow in volume expanders at whatever rate the provider thinks is essential. Usually you're going to be using normal saline or lactated ringers.